Hey, can I help?
No, you can't help Reese.
Is it like illegal?
Hey guys, welcome back. Hope you enjoyed your cute little minute break. I'm back. I have students in here now, so if you see any strange children, it would be my students. They're in the ninth grade. Bless them. Just bless them. Do you want to go ahead and introduce yourself, Reese?
I'm Reese.
He's just precious. You just want to pinch his cheeks and potentially strangle him at the same time. It's a very unique feeling. I love him though. He's fresh. Okay, guys. So we're back to our case study with Alonzo, talking with Joan about ways to decrease their stress. It's really important to look at your patient's environment and see how you can help them manage stress, specifically if they've got those stress-induced conditions, hypertension. They're not insomnia, all those different things that affect your life related to stress and anxiety. Okay, so training specific therapies. I found this interesting. I was looking at my notes and I said, requires extra training, dot, dot, dot. Can't watch it on YouTube. So these are all things that require specific training by other licensed professionals. They're great ways, again, to really help your patients take a pass if you're leaving.
I'm going to
Okay. Really to help your patients take advantage of some of those alternative medicine therapies. Acupuncture is awesome. I see it all the time. Cupping, if you remember from the Summer Olympics, Michael Phelps had those circular dots all over his back. That cupping helps. My sister-in-law uses it and loves it. She's an athletic trainer. Therapeutic touch, chiropractic therapy are all great ways to really help our patients maximize their health and their quality of life. Okay, biofeedback is just a mind-body techniques that uses instruments to kind of measure the response that your body gives to certain stimuli. It's a great way to help patients who've had that are in stroke recovery, smoking cessation, ADHD, epilepsy, GI issues, GU disorders. Because it kind of looks at the muscles and their response and your nervous system and their response to stimuli and gives it something biofeedback so that there can be changes made or treatments given to help with that. Acupuncture, I've never done it, but I think it will be awesome. It regulates and realigns your vital energy. It flows through channels or systems called meridians. It's a great way to really help with pain. It's really great with pain. As you can see on your slide, it's effective for pain management. It's also used to treat different disorders and varying effectiveness, arthritis, headaches, muscle pain. Acupuncture is awesome. I have friends, real athletic friends, that use it all the time and really, really live for it. They love it. It really helps with their muscle recovery and different things like that with their CrossFit competitions. Okay, so we're back to our case study about Joan. Even though our complementary and alternative medicine methods may help her blood pressure, she needs to make sure she takes her hypertensive medication. Specifically, if she's got stroke level hypertension, we want to make sure we get that under control immediately. And then we can use those alternative medicine therapies to help assist the medication. And then as those therapies help control it, then we can take her off her medicine. Okay? I said massage envy. It's a great thing. When y'all get into real life, making real money, definitely invest in some massage therapy. Okay, therapeutic touch. I love this idea of therapeutic touch. People need to be touched. It is just a part of who we are as people, and it's a great way to really help improve someone's well-being. Hugs. I love hugs. They're a great way to really do that touch therapy without, having to pay somebody to do it for you. I remember on Facebook several years ago, there was a lady who would go and cuddle with people. Like that was her job. She would go and spoon with people. None of that frisky business. But she would just go and spoon because people just want to be held. They want that touch. They want that connection to another person. And therapeutic touch is a great way to help facilitate that. It treats pain, dementia, any type of trauma, anxiety, and it's just a great way to really help patients just connect and decrease that anxiety and stress. Okay, traditional Chinese medicine. It works on life and balance, it's health promotion. That idea of yin and yang is opposing and complementary forces that exist. Methods to evaluate a patient's condition. It's one of those things you have to be trained to do. You can't YouTube it and learn how to be a Chinese medicine person. They do it the same way that the healthcare does: observing, hearing, asking, interviewing, touching, palpating. It does have some therapeutic modalities specifically related to certain types of herbs. The most important thing about any type of alternative and complementary medicine is we've got to make sure that we know what our patients are using and that we communicate that, because some of these therapies can interfere with traditional medicine. And it's very important for us to know in depth what our patients are using as far as supplements, oils, any type of alternative medicine. Okay, now we're moving on to natural products and herbal therapies. Y'all have seen these. There's tons and tons and tons everywhere. You can sell them, you can buy them, you can grow them, whatever you want to. And they're just natural products, chemical compounds that really are used to help better the functioning of the body. Again, fish oil, I think about fish oil because I take fish oil to help with your cholesterol. B12 to help with energy, vitamin C to help with your immune system, melatonin to help with sleep. All of these things are natural products and herbs that we use to help make our body function better. It's interesting to know that herbal medicines are not approved for use as drugs and are not regulated by the FDA. So before you buy into a pyramid scheme about selling something, please be sure that you understand that the FDA does not regulate the production and selling of these medications or herbs and supplements. You want to make sure this is interesting. I want to make sure y'all can see this at the bottom. Look for the U.S. Pharmacopoeia Verified Dietary Supplement mark. Okay, that means that they have been assessed by a reputable source. Okay, back on to our case study. Joan's follow-up visit. Joan tells Alonzo that she would like to learn relaxation responses. Joan is excited about having control over a behavior that can help her manage her blood pressure, and so she eagerly learns. Joan reports that she and Thomas have assigned the children household duties, and so Joan had a free hour at night before she didn't know what to do with herself. So it's important to help facilitate our patients really understanding where they can make life changes in order to better manage their health. Okay, here's a quick quiz. An athletic young woman has just fractured her leg while training for a marathon. The use of meditation has many physiological properties that may help the young woman to, raise blood pressure, increase mood swings, increase oxygen consumption, or lower muscle tension. Okay, definitely going to be lower muscle tension. That's important with the fracture because you want those muscles to heal, and they heal best when they're relaxed. Okay. Last but not least, our final slide for the day, the integrated nursing role. Again, we've got to make sure that we know what our patients are using to make sure that our traditional Western medicine isn't going to interact with any of their herbal supplements or any of their other alternative medicine therapies. We need to encourage dialogue. We need to make sure we know what's going on with our patients. It's our responsibility to understand the benefits of these therapies and encourage active patient participation. There's no one-stop shop as far as fixing medical conditions. Diabetes, hypertension, obesity, glaucoma, all these different things all affect our well-being, and there's not just one pill that's going to make it better. We have to utilize these alternative and complementary therapies. We want to make sure, I love this idea of multiple practitioner approach. That multidisciplinary team is so very important to ensuring the quality of life for our patients. We want people involved that know what they're doing because we are not going to be experts about everything. It's very holistic in nature. It's also important to make sure you follow the Nurse Practice Act and scope of practice for your state. Remember, they do alter by state, they do change by state, so make sure that you know where you're at and what options that you have. Okay, and work closely with your patient. Again, that last point is just so very, very important. You've got to work closely with your patient. You've got to establish that trust to make sure that y'all are communicating effectively and making the right decisions about their care. I remember doing and seeing this lecture in nursing school. Please keep in mind it was like 14 years ago. And I was like, oh, this stuff is all crazy. Like, who does this? But as I've grown older and been exposed to the benefits of these alternative therapies, I know it's so very important for us to know what our patients are using, to give them options of alternative therapies besides just medicine, because sometimes medicine doesn't work exactly like it's supposed to. And there's lots of stuff out there nowadays. We just want to make sure that our patients know how to find good, reputable people to help them when we're not the experts. I hope y'all have a great Friday. Get some relaxation going on this weekend, maybe. I'm pretty sure y'all have a test on Tuesday, so y'all probably be studying. But I'll see y'all Monday in person. I know y'all are so excited about that. I'm teaching about electrolytes, so we'll be learning some fun and exciting stuff together. Y'all have a great Friday, and I'll see you soon.